Hello everyone. Today we'll be discussing the basic concepts of temporomandibular joint, and we'll be doing this in a question and answer format. So the first question is, what are the parts of the articular cartilage and what is its relationship to centric relation? So we'll be looking at the articular cartilage. As you can see, the articular cartilage is, which is also known as the articular disc. It is actually interposed between the condylar head and the mandibular fossa, which is also known as the glenoid fossa, which is actually a part of the temporal bone. So the articular disc is actually in between the condylar head of the mandible and the glenoid fossa of the temporal bone, and it lies in between that. So articular disc, uh, in terms of its function, it is divided into three parts. Here I will try to highlight it. So these three parts, there's the anterior part here, then we have the intermediate part, and then the last is the posterior part. So although these are three different parts here, but they are all of they're actually one articular cartilage, and in terms of function they are different, and in terms of histological appearance they're also distinct, but anatomically there's just one articular disc. And for functional purposes, we have divided into three parts: the anterior part, the intermediate part, and the posterior part. The thickest part is the posterior part, which is followed by the anterior part and then the intermediate part. So as you can see, the thinnest part is in the intermediate part, and this is where the condylar disc or the condylar head rests during its rest position. So the shape of the intermediate portion of the articular disc is such that the condylar head of the mandible, it fits snugly inside the articular disc, and this is the anterior and superior most position of the condyle with respect to the articular eminence, and this position is known as the centric relation, which is the relationship of the condyle uh, to the intermediate part of the articular disc, and this part is usually the anterior and superior most position with respect to the articular eminence. So the question was, okay, what are the parts of articular cartilage? So we have three parts. I'm trying to recapitulate here. The first part is the intermediate part, and then we have the anterior part and the posterior part. The posterior part of the articular disc is actually confluent with the retrodiscal tissues. The the unique characteristics of articular disc is that it is aneural and avascular, meaning it is devoid of any blood vessels and it doesn't have any neural elements or nerves in it. So, okay, so what are the two movements that are possible in the temporomandibular joints? The two movements that are inherent in the temporomandibular joints are, as you can see, the articular disc actually divides uh, this cavity or articular cavity into two parts. We have a superior cavity and then we have the inferior cavity, and it is divided into two halves by the articular disc. And inside both of these cavities there is synovial membrane. It is lined by the synovial membrane, and it has synovial fluid in both the cavities. So the inferior cavity, in the inferior cavity, the main uh, the main temporomandibular movement that takes place is the rotation or the hinge type movement. So what happens is the condylar head, it actually rotates around its horizontal axis, and this takes place primarily in the inferior cavity. And when the condylar head rotates, the mouth opens, and up to 20 millimeters or 2 centimeter of mouth opening is related to the rotation of the condylar head, and this takes place primarily in the inferior cavity. If we open our mouth uh, more than 20 millimeters or 2 centimeters. That is, if we are attempting uh, our mouth opening more than that, uh, so what will happen is that there will be translatory movement. It means the condylar head will actually slide or glide down the articular eminence, and this sliding or gliding uh, movement is known as translatory movement, and this translation takes place primarily in the superior cavity. So the two uh, temporomandibular movements that we can see in the temporomandibular joint are the rotation and translation. Rotation takes place in the inferior cavity and it is associated with mouth opening, while translation takes place in the superior cavity and it is related to excessive mouth opening or mouth opening beyond 2 centimeters or 20 millimeters. Now the question arises, why is centric relation a muscle and ligament derived position? We've already discussed why it is centric relation. Uh, During centric relation, the condylar head, it actually rests against the intermediate portion of the articular disc, and this happens to be the anterior and superiormost position of the condyle with respect to the mandibular fossa and with respect to the articular eminence. Now we'll be looking briefly at centric relation. So this is the place, this is the intermediate portion in which the head of the condyle, it fits snugly as if it is resting on a pillow, and this pillow shape is provided by the intermediate portion and the thicker posterior part of the articular disc. So centric relation is primarily a superior and anterior most position of the condyle with respect to the articular eminence, and it is considered to be the most stable position of the condyle, and not only that, it is also the rest position of the condyle. Now, why is it a ligament derived position and a muscle derived position? It is a muscle derived position due to the directional pull of the muscles of mastication. Here, as you can see, there are two muscles here. These two muscles are masseter muscle that has been shown here and the temporalis muscle. As you can see, the pull of these muscles, the pull of the masseter muscle is anterior, while the pull of the temporalis muscle is uh, superior. So the anterior and superior most position of the condyle is because of the directional pull of the muscles of mastication, and specifically the anterior pull of the masseter muscle and the medial pterygoid muscle, and the superior pull of the temporalis muscle. And because of this directional pull of the muscles of mastication as well as the temporomandibular joint ligaments as well as the lateral ligament, what happens is the condyle disc assembly is positioned in its anterior and superior most position, and that is the centric relation or the relation of the condyles with respect to the mandibular fossa. So now the question arises, what is the difference between centric relation and centric occlusion? We've already discussed centric relation, and centric relation is the relation of the condyle, hence the condylar related position, and this position is anterior and superior most position with respect to the glenoid fossa or the articular eminence. Now we have, as you can see in this picture, the teeth are in maximum intercuspation. They are maximally in contact with each other. There are different terminologies related to it. Maximum intercuspation, or MI, is also known as centric occlusion, and in some books you can find the terms habitual occlusion or habitual centric, and it is primarily a tooth related position, and it describes an occlusal position. The teeth are maximally in contact with each other in a position that the patient finds it comfortable, although it is easily achievable, but it is not easily reproducible. So what happens is sometimes when the patient clenches his or her teeth, they might not be in maximum anticipation. That means not all of the teeth might not be in contact with each other, and you would have to direct the patient or guide the patient so that he closes his or her teeth in maximum so that the teeth are maximally in contact with each other. So centric occlusion or maximum intercrispation is a tooth related position, and while centric relation is a condylar related position, and it describes the anterior and superior position of the condyle with respect to the glenoid fossa, while centric occlusion is a tooth related position in which the teeth are maximally in contact with each other. So now we'll be discussing what are the possible functions of temporomandibular joint. Now the functions of temporomandibular joint are related to the mandibular movements, and these mandibular movements are actually the functional positions that are involved in chewing and swallowing, in speech and aesthetics. So all of these movements take place through the temporomandibular joint, because temporomandibular joint, it actually directs movement in the mandible. So besides those, the multiple movements that are actually take place through the temporomandibular joint, through the movement of the condyle within the condylar, the glenoid fossa, are the opening, closing, protrusion, retrusion, and lateral excursive movements are also known as eccentric movements. By lateral excursive movements, we mean the right and left movements of the mandible with respect to the maxilla that takes place during mastication and during chewing of food. So we'll just briefly look at these eccentric movements of the mandible. Eccentric movements means away from the center, and these are the right and left chewing movements of the mandible with respect to the maxillary teeth. So protrusive movement, by protrusion or protrusive movement, we mean the anterior movement of the mandible. So when the teeth are maximally in contact with each other and we move our teeth anteriorly, then this is known as, or the forward movement is known as the protrusive movement. While retrusive is when we have moved our teeth forward. If we take our teeth backwards, then this is known as retrusive or posterior movement of the mandible. While eccentric or right and left movements are away from the centric position of the mandible, whether they are in central relation or maximum intercrispation. That is all for now. Thank you for listening.